Hello, my name is Talisa Ramirez. I'm in the BSN 225. I am doing the subcutaneous injection. I have my correct badge, correct scrubs. I have my supplies. So I'm gonna get started. So first I'm gonna look at the provider's order. I'm gonna state the 6 rights of medication, which are right documentation, right dose, right patient, right time, right medication, right route. Next, I'm going to verify the EHR. The order is for heparin, 1,000 units subcutaneous. Next, I am going to calculate the dose. It is equal to 1 ml of heparin. So I'm going to gather my supplies, knock on the patient's door, provide privacy, make sure my patient doesn't have any family in the room. Hi, my name's Talisa. I'm going to be your nurse today. Can you tell me your name and date of birth? I'm going to verify that on the armband. Do my second medication verification. Do you have any allergies to food, medication, or seasonal allergies? Okay, Mrs. Smith doesn't have any allergies. Okay, so Mrs. Smith, the reason that I'm here is because your doctor has an order for your heparin injection, a subcutaneous heparin injection. Heparin is used to decrease the clotting ability of the blood. Some of the side effects are fever and hypersensitivity. Some of the adverse effects are bleeding and heparin-induced thrombocytopenia. If you experience any of the adverse effects, please let me know. Upon injection, you might feel a slight stinging or burning sensation, but this is normal. Do you have any questions? No questions. Okay, so I'm going to perform hand hygiene. I'm going to put on my gloves. So the needle that I'm using is a 1 ml 25 gauge 5/8 needle. Okay, so I'm going to mix my medicine, roll it. Clean it. And while that dries, I'm gonna draw up the 1 ml of air. I'm going to inject the air. Invert the bottle. I'm going to recap the needle. There is no air. And that is 1 ml of heparin. Okay, so I'm going to check this is in her abdomen. I'm going to check the area for any bruises, inflammation, edema, masses, tenderness. Is this painful? No, okay. I'm going to measure grasp the skin and measure that it is 1/2 of the fold. And it is. Okay. So now I'm going to clean this. Turn it a little bit. Yeah. Okay. I'm going to clean the site. Okay, so I'm going to grasp the skin. I'm going at a 45 to 90 degree angle. I'm holding the needle like a dart, palm side down. And you want to inject quickly. Place the needle quickly, inject slowly. I think I said that right. Okay. Quickly. You want to grasp it to stabilize it, and you want to inject slowly over several seconds. Remove my hand. I'm going to take the needle out, put it into the sharps container. I'm going to place my gauze over the site. Do not massage the site. Okay, my patient is not bleeding. Okay, I'm going to remove my gloves, perform hand hygiene, and document.